Hello, today is April the 24th, 2021. My name is Arcelia Balboa, and I'm interviewing Gabriela Smith for the South Texas Archives at Texas A&M University, Kingsville.
This is a part of the Voces of Pandemic Oral History Project in partnership with Voces Oral History Center at the University of Texas, Austin. So I'm going to be interviewing Gabriela Balboa Smith, and we're going to be recording. And so we're going to start with the very first question. First of all, Gabriela, how are you doing today?
I'm doing good, Mom.
Good, good.
Good day.
Good, awesome. And so the very first question that I'll be asking you, and first of all, at any given time that you would like to stop or elaborate, or if I ask you a question that maybe perhaps it's not something that you're wanting to answer, so just please just let me know and feel free to do that. So tell me a little bit about yourself and the experience with COVID-19.
Yes. So I think I've had a really interesting experience with COVID. I think this global pandemic has been a real eye-opener. For me, I personally have been diagnosed with COVID-19. I've had it for about 5 weeks now. And my experience with it is that it's a deadly disease in that context of like the infection. But on the other side of it, I've noticed that, things have changed in my life since COVID and since the pandemic. And I guess that's my answer.
And so what brings you to Texas?
Yeah, so when COVID first happened, so a year ago now, it's crazy, it's been a year. When it first happened, I was living in Vermont, about 2,000 miles away from all my family. And it was a really scary time for me because I didn't have any support in New England where I was, and we're in the middle of a global pandemic and things were shutting down. And I kind of had one of those eye-opening experiences I was telling you about, where I realized quickly how important my family was and how much I wanted to be closer to my family.
Right.
And so in a sense, COVID almost provided this like silver lining where I had to experience this in order to snap out of it and realize, you need to get your butt home and you need to be with your family. So that's kind of my story. And I moved to Texas from the state of Vermont after living in Vermont for 14 years in November. And I've been in the state of Texas since November. And all of that, again, probably would not have happened if COVID wouldn't have happened. It scared me into
I'm
coming.
definitely grateful for it.
Sure you are, Mom.
Not in the bad way, but I'm glad to have you back in Texas. It's been 14 years that you decided to leave home, and
it only took a global pandemic.
Right? Exactly. So, okay. So, what was your first initial reaction with all the information with COVID-19?
I think I was very scared when I first heard it, probably like everyone. I like watching like those sci-fi movies about stuff, and I've seen movies where there's like a virus and everybody gets sick. And so for me, I was definitely scared, and I knew that that's one thing that probably could really impact civilization as we know it more than anything else, is if there was a deadly virus that is kind of respiratory based, and that's what COVID is. So yeah, scary stuff.
Yes, it is. So do you have any children?
No, nope, no kids.
No children.
Kids. No children.
Are you married?
No. Nope.
Okay. So tell me a little bit about your family members that live here in the U.S. and those who do not.
Okay, so just a little bit about them and how they're doing, or related to COVID, or
related to COVID. As I asked you the question, how did COVID-19 impact it? And so, of course, I asked you if you had any children, and and so now I want to kind of reach out to you and kind of tell me a little bit about your family members that do live here, you know.
Mm-hmm. Yeah. So I have, I think, a good sized family of you, my mom, my dad. I have three sisters, a brother, and that's kind of my immediate family. None of them have tested positive for COVID or have been directly affected by the virus. Thank God, I'm the only one in the family that actually contracted that. But yeah, my little brother is in school right now. He's a senior. So I'm sure that's been an experience for you, Mom, that he had to go and learn virtual learning his senior year of school. His senior year has been really choppy and he hasn't really been able to be with his friends. So
Yeah.
I've seen how that's affected him. But in terms of my other family members, I believe it's affected you, Mom, because you now you're going to school from home because you were at high risk. So that affected you. I think for Maria, my other sister, how it affected her was she also did remote work. She went from having a job that she went in every day to the office, just like everyone else. And then COVID happened and they started sending people to work from home. So that affected my sister. And then I think the person in the family it's really affected a lot too is my dad. And my dad is, so he's a program director for immunizations for, is it the San
Patricio County.
San Patricio County. So he's had a real direct, I guess, kind of vision in like the whole vaccination part that we maybe don't see because that's kind of his specialization. So I know it's affected him for that. Like that's his livelihood. His job has been to set up these clinics and to make sure that people are getting vaccinated and tested. So I think COVID is, like I said, and I explained, it's affected everyone in a different way. Certainly like the working from home and getting used to the new norm and being socially distant.
Right. And so with all that and said, so my next question, Gabriela, is how is how's everything going, like as far as like functions, family functions, and perhaps the church, you know, attending church or different organizations, but the fact how COVID-19 hit and with all that, you know, how has it impacted you and your family?
Yeah, so I feel like when I think of COVID, it hits me in two phases. It hits me in the phase where I was in Vermont and then the phase where now I'm in Texas. When I was in Vermont, it was interesting because I didn't have any family in the whole state of Vermont. My nearest family member was 2,000 miles away. So I didn't really feel the effects of like, I guess not being able to see family because they weren't around to begin with, but it definitely affected me being able to see my friends or, you know, do kind of like outdoor functions and do socially, like just social functions in general. And then I think now it's affected now that I'm in Texas and I'm with my family. We kind of have a tight group already, and I think we're all kind of in each other's bubble. So we've stayed pretty close through COVID. We thankfully haven't had to like quarantine from each other. I mean, I quarantined for my 2 weeks when I had COVID, but for the most part, we're kind of a part of the same household. So it hasn't affected us like that. But how it has affected us is what I would say is with my grandmother. So my grandmother is considered high risk and we have a great relationship with her. We like for her to come on the weekends just so she could have a place to get away. And that's something that we've had to modify because of COVID. We have had to kind of limit our interactions with my grandmother. And I know that's been hard because it is normal for us to see her more regularly. But we just can't. We just can't do that right now.
So, if you would like to talk to us about, you know, you said that you were positive for COVID, and is there anything that you would like to talk to us about? I mean, you know, since we're in the subject of family and how it has impacted the family. So, and being that you just mentioned that we're a very close niche family, and so, how did this affect you?
Mm-hmm. I mean, it affected me in the sense that, again, I realized how important family is. Not that I didn't realize that before, but I think I didn't make it like a focal point of my life, the idea of like family and being close to family. But I think when you have a global pandemic and over 300,000 people in our country have died, and you see the impact and you see how many people's lives have been affected, how many grandmothers aren't coming home, how many aunts and uncles aren't around anymore, it kind of just changes your whole mindset of like what's important to you and what's not. So for me, it's made me realize that above all else, what is important, okay. But above all else, what is important is family. Above all else, that's what's important. And I think that's kind of, for me, like the silver lining that's gotten me through COVID, this whole
Yeah.
experience is having family. So I'm sure there's a lot of people out there that feel the same way, but that's my take on it.
Mm-hmm. Yeah. So, considering that, of course, it could happen to anybody, we're very careful having your father, practice and make us practice, the social distance and, washing our hands and what CDC requirements are. And so, with contracting COVID,
Mhm.
it impacted you. And so careful that we were, for the people
Mhm.
that are out there, and that sometimes we have this mind kind of perception of that perhaps maybe someone wasn't careful, and
Mhm.
you get COVID and things like that. So being that we always were careful, and you contracted COVID. So what was the feeling of, how did you feel like when
When I
you
got
got,
COVID,
yes, when you got
yeah.
COVID? How did you feel? And because I know there for a while as a mother, I was
Mhm.
scared for you. And
Mhm.
so, and of course, we kept you in quarantine. The whole family was, but for the most part, you were. And so we kept you
Yeah.
isolated from everybody. So, I'm kind of just
Yeah,
want to pick at that.
mentally, it was an interesting experience because, and this is probably funny, but I compare it to, or not funny, but interesting. I compare it to like leprosy. In the Bible, people don't touch lepers and you keep a distance from them and you stay away from them. So on one end, I felt like that when I had COVID because I realized that this infection I had inside of me could possibly hurt another person and take their life.
Right.
And so that was scary. And so I had to be cautious of who I interacted with and made sure that I did socially distance, I did quarantine. But it feels isolating. It feels isolating when you feel like something inside of you can possibly cause harm to another person. And that's what COVID is. And that's the way the infection works, is you get it and it takes over your immune system, and then you can possibly spread it to another person unintentionally.
Right.
So it's scary in that sense, and it was very isolating for me. Back to kind of the leper analogy of not being able to see people. I mean, even now I'm still testing positive for COVID, but I'm not going out into public or anything. But it's very isolating, and I think doing the kind of quarantine thing was it was interesting and it was helpful for me because it forced me to reset everything in my life. It affected so many things. It affected my career. I work full-time as a corporate trainer. I work remotely. I wasn't able to continue working. It affected my relationship with my family because I had to stay cooped up in my room. I actually had to apply for medical leave through my employer because of COVID. And then not to mention the health aspects that have come from COVID. Like I developed pneumonia, I developed some blood clots. So there's some residue of COVID still left on me, and it's been definitely impacted me in different ways in terms of my health, but even so my mental health.
And I think that what is the most interesting thing for me, that I see it happening with you is that it was the aftermath,
Yeah.
and you never had the high fevers, which, thanks to God that you didn't go through the high fevers, but you were having a lot of problems breathing, and your coughing was so intense there for a while. Am I correct?
Yes. Yeah. So when I met with my last doctor, they said that, and they said this verbatim, they said, you were an ideal COVID target. I had pre-existing conditions. I had an autoimmune disorder, Hashimoto's. I had asthma at the time. I was a smoker. I was smoking almost a pack of cigarettes a day. I was overweight. So all of those things we kept seeing in the news of the pre-existing conditions, I had them all at once. And it affected my health, affected
And
my lungs. The
you
lungs has
became
been,
I'm sorry, you became asthmatic back when you returned back to Texas, right?
yes, exactly. So when I was younger, I was asthmatic, growing up in South Texas. And then when I moved to Vermont in my teens, the air there is so different. There's not a lot, there's no refineries, any of that. And the altitude is higher. So I think the air is just different. And I didn't have issues with breathing in Vermont. And then when I came back to Texas in November, I noticed my asthma symptoms started coming back.
Right.
And then with COVID, it just turned my asthma back on. That's what it feels like it did. Asthma was always dormant. It was always there. It just wasn't showing up. And then with COVID, now it's more prevalent. But I often tell people the breathing part was the scariest experience. I think for number one, it's the reason why I decided to quit smoking, because I realized it's scary when you have issues, when you have trouble breathing. That's what was scary about COVID, because there were times where, I was at home, my family's taking care of me, I had medicine, but there were moments where for like a second, I was afraid I wasn't gonna be able to breathe again, or breathing was so difficult that I was afraid I wouldn't be able to do it. And that feeling of not being able to fully use your lungs and fully breathe is something that I will never forget. So now I've decided I don't ever want to do that again. I don't ever want to put myself in a situation where I can't breathe.
Right.
And so smoking is something that is bad for your lungs. And that's something, another silver lining from COVID. Mom, I'm sure you're happy. I'm not a smoker anymore. So it really forced me to look at life and things differently, and family.
Right. And so, what are the challenges that you face now with, with COVID, and you shared with us that that you were on medical leave, and being so thankful, because sometimes not everybody is so fortunate like yourself and others that that you had insurance, and that you had the fact that you could apply for leave of absence, because there's a lot of people out there that
I don't have that option.
that don't have that option, especially in our uh, our Chicano or Latino part of our I guess our, I can't even
Community.
think, yeah, our community. that sometimes, not everybody does have that,
Yeah, I do have a lot of gratitude coming out of that. I think that's the only way you can like recover from a traumatic experience. And for me, I'm gonna remember this for the rest of my life. I'm gonna remember this experience, this whole everything. It's gonna be with me forever. And gratitude, I think, is the best way to, I guess, heal or recover from that. So
Mm-hmm.
I'm grateful that even though I got COVID, I'm grateful I had my family. I'm grateful that you were there. I'm grateful that my dad, who's a nurse, was able to check on me and had that medical expertise. I'm grateful that I had you, Mom, to help cook my meals and nurse me back to good health. I'm grateful that my family members, anytime I needed a new medication, or there was a time where we were looking all over town for a nebulizer, which was really
Yeah.
scary, how
Right.
all of my family members, it was a hunt, all of us looking for a nebulizer, any
For
nebulizer in
almost a
town,
week.
for almost a week, just so I
Right.
could breathe. I
Yeah.
was grateful for that. I was grateful for the fact that I did have a job, like you said, where I was able to take paid medical leave for up to 3 months, full benefits, still receiving everything. I'm grateful for that. I'm grateful that I had insurance, because another thing that comes from COVID that people maybe don't realize or are really documenting or talking about right now is the financial implications of COVID. I
Right.
know for me, somebody who's 31, relatively healthy, has health insurance. My bills, everything combined, from my ER visits, my urgent care, everything, I'm going to be paying on this probably for the next year. Um, and so that all adds up. The copays, the doctor's visits, when you get labs done, when you get a CT scan, there's a price tag to all of that. So I am grateful that I had insurance and that I was someone who could afford that. And then I'm also grateful that um, for just medical people in the medical field in general. Every nurse that I've come across this entire experience, every doctor has been just so careful and just caring and loving and
And
helpful towards me
understanding.
and understanding, because I think when you get diagnosed with COVID and it's affecting your life, it's a scary thing, and it's nice to have medical professionals that they see it in your eyes, they see that you're
Right.
scared,
And you
that
know
they help
what?
you.
And you know what, Gabriela, is that
Mhm.
you pointed out an interesting fact there when you were mentioning that the nurses and how grateful you are with that. One of the things that I experienced, when I took you to the ER and all that, of course they sent me away, and so
Mhm.
for the ones that weren't so lucky, that really, really got to, I guess, fighting for their life, not having anybody there for them. That's all that I could think. And I didn't
Mhm.
even want to leave the parking lot. Like, I literally stayed there for, what was it, 5 hours, 6 hours at the
Mhm.
emergency room. And, they ran all these tests on you and all that. And it's a very scary, you know, situation
Mhm.
for anyone to
It
be.
is. And the isolating part that I was talking about, that was
Yeah.
also scary, because when it was admitted into the hospital, I don't know if you knew this, but they section off people that are COVID patients. So if you're
Yeah.
COVID, you move to a totally different wing, and
Right.
nobody can go in there. You can't have visitors, and people are coming in with like suits and stuff,
Right.
and it's really scary. I think for me, I realized in that moment that I wanted to recover and do everything I could to get better from COVID, because I could see that if I got worse, it would mean I would be in the hospital, where I'm back in that environment of not being with family, of being totally isolated, of being
Right.
put sectioned off. And to me, I'm such a free spirit, that scared me so much that when I
Right.
left the emergency room, I mean, you saw me, I had a totally different mindset. I'm like, I'm going to eat good. I'm going to take all my meds. I'm going to do everything in my control, in my power, to make sure that I don't get worse.
Is this one of the things that inspired you now that, of course, with your job, you know, you have a very good job, and uh, you are a college graduate, and you want to elaborate about that, and
Yeah.
how
So, yeah.
you've
So
turned it
my
into a positive, and I think
exactly.
that's what I
So
want to talk about. Yeah.
yeah. So COVID, again, I told you guys about, all of the changes it's impacted in my life. But some other changes that I didn't anticipate it would affect would be like my career path. Currently, I work in the corporate world as a learning and development analyst, so I'm a corporate trainer. And after COVID, or during COVID, I had a lot of time where it was just me and my thoughts in my head, in my room, with nobody else there. So it was me facing myself. And during that time, I used that to kind of reflect. There wasn't much I can do. My breathing was still bad. I couldn't get up and do things. I mean, I had to stay in bed. And so I started thinking about like my experience, all of the doctors I've seen, the nurses, the love, the care from so many people, from, volunteers to people like at the clinics to people that are like, helping distribute vaccines. I thought of all of that and I realized that I wanted to be in a career field where I could impact and help people like that. So it changed my whole idea. I went from business, I saw myself, I'm going to be a vice president one day. The other side, I realized actually what I want to do is I want to help people. And one of my dreams had always been to go to medical school, but that just never happened. But when I, again, was alone with my thoughts and COVID and thinking about stuff, and I was like, well, what's standing in my way of being a doctor? I know I would love to be a doctor. I'd love to go to medical school. I want to help people the way that so many medical professionals helped me when I was at my weakest. And I realized the only thing was that I was worried about my age. And I just broke through that. And I realized, you know what, I might go to medical school in my 30s, but that's not a big deal. So, and I kind of now moving forward, I guess my announcement is I'm going to be applying to medical school in the next year. Hoping I get in. If I don't, I know I tried. But this whole experience just kind of made me realize like my purpose in life and what I want to do to help the world. And it made me realize that I want to help people,
Right.
and specifically, I'm interested in like palliative care, which is care for people that they're at their end stages of life. And
Right.
so you're a doctor that does everything that you possibly can to make sure that they pass with as
Right.
much happiness and dignity as possible. So
And that's why I wanted to elaborate on that, because, you know, sometimes we hear all the negative things that COVID brings. And as yourself, you're a COVID survivor. And the aftermath, you know, for you, you know, it left you with a blood clot and pneumonia, so asthma, and so all those things, you know, and you know, just taking a moment, like you said, that, you know, only your thoughts were in with you, you know, when you were in the room, and you turned it into a positive thing. And so sometimes, you know, when we experience things that really affect, you know, your everything about you, your whole world is just turned upside down, you know, for you and for others, and you know, and just turning something into a positive. I really wanted you to talk about that, and I really do appreciate that, you know, you have taken time, and I know you're still healing. And so but before I end this, I kind of wanted to share something you know, that I forgot in the beginning. And so and that was just what I wanted to say was that you give permission, you know, for this interview, you know, for
yeah.
whatever Voz needs, you know, the organization, the Voices of the pandemic. and so I just wanted to make sure that you're okay,
Yeah.
you know, if, you know, it's sit in the library or use it for whatever
Mhm.
purpose. And so I just wanted to, I had forgotten to mention that in the beginning. And so with all that, it's awesome, you know, to know that
Mhm.
you're doing better. And even though that there was a lot of things that, you know, that you might have experienced, and so many changes, you know, like, you know, people wearing masks and all
Mhm.
that, you know, having to do the social distancing and but anyway, I wanted to leave it in a happy note as a and a positive thing. And
Mhm.
so with all that, I just want to thank you for your time and
Mhm.
everything, Gabriela.
Yes, thank you. I love talking about this. I could talk about this stuff all day. And yeah, I guess I don't know. My advice to people is like when you find your time, when you find yourself in stressful and trying times, just to remember gratitude. There's always
Yeah,
something tiny, tiniest little thing you can be grateful about, and that
yeah.
I think it kind of reprograms your
Because
whole
it could be
mindset.
taken away from you in a heartbeat, like with just from
Hmm.
one day to another. You have
Exactly.
you are so blessed, and I'm so
Mhm.
glad that you're still here with us, Mama. I love you.
Me too. I love you too, Mom. All right.
So,
Thank
all
you.
righty, but thank you very much.
Thank you.